So you've been diagnosed with FPIES. Now what? If you're a bit flustered with the lack of guidance and information available, you've come to the right place. Some of this also applies to other non-IgE mediated allergies that are even less known than FPIES. I've lived with it for 30 plus years since my severe episode started, and now it's been 10 plus years knowing what it is. So let me share with you my experience along with what the research tells us. FPIES used to be thought of as an infant disease. We now know it exists in all ages. Yes, adults, and now finally research is reporting teens as well. They may never have outgrown it, or it can start at that age too. First, the good news. No fatalities have been reported yet from FPIES, despite its severe presentation with shock. Although I do wonder about the atypical cases that also have IgE sensitization. And even more broadly in the world of allergies, despite their increase and the increase in anaphylaxis worldwide, fatal reactions are actually decreasing. Knowing the signs, knowing what to do, having epinephrine on hand if relevant, and access to emergency services make the difference. Access to testing and life-saving medication for all would be great to decrease these stats even further. This knowledge and preparation is what the rest of this video is about. So what do you do when you have a reaction? First, increase fluids. The main cause of FPIES shock is due to a rapid loss of fluids through vomiting and diarrhea. Take small sips of water or suck on ice chips. If you can't keep fluids down, seriously consider getting to emergency care. Ondansetron or Zofran is usually used for vomiting. Ask your doctor if you can have this prescribed to keep on hand. Is there anything that can halt the reaction, help with the extreme pain? If you Google this, you'll be told antihistamines don't work because FPIES isn't IgE mediated. It's not quite that simple. Even though it's not a classic IgE allergy, there is mast cell activation. Remember, the mast cell has multiple ways of activating, and we know this happens in FPIES from things like elevated tryptase levels. I think that's why histamine blockers do work a bit to blunt the pain. You can try over-the-counter antihistamines. A combination of H1 and H2 blockers may work best. What are those? H1 blockers are your standard allergy antihistamines like Benadryl. H2 blockers are meds like Pepcid that target a different histamine receptor in the gut, which is exactly where FPIES and other gastrointestinal allergy hit hard. Most of my reactions I had to endure without relief, and the pain is extreme, as I talked about in my previous video. I've been able to avoid my worst reactions since finding all my triggers, but when I did have milder reactions due to things like unexpected cross-contamination, antihistamines, as soon as the cramps started, seemed to take the edge off of the pain. For what it's worth, another widely available medicine for similar symptoms, Pepto-Bismol, did not seem to do anything because they work by a different mechanism. For severe reactions, the standard FPIES shock treatment is IV fluids, not epinephrine, because epinephrine works by strengthening the heartbeat and blood vessels, but does not replace the missing fluids. But if you have mixed IgE and non-IgE allergies like I used to, or if there's any difficulty breathing or a rapid drop in blood pressure, err on the side of caution and use your EpiPen as early as possible and go to or call emergency services. Using the EpiPen unnecessarily shouldn't give you any lasting problems, but waiting can. Don't run to get your meds though. Walk or have someone else bring it to you if possible. Running can boost your reaction in a way that you don't want. The good news is the ER has tools for whatever is happening regardless of mechanism. The power of modern medicine right there. It can keep you alive even if we don't yet know how all of this is happening. For extra peace of mind, you could print out and have with you a letter for the emergency department from fpies.org. I will link in the descriptions below. This place, I remember, was one of the few resources that existed 10 plus years ago, and I was happy to find that they now also have information on adult FPIES. Important warning. Tell at least one person you are having a reaction before you get stuck in the bathroom or worst case lose consciousness. This is true for all allergies and especially worth reminding teens and young adults. They have the highest risk of a fatal reaction. Why? Their immune systems are strong and they are no longer under the close monitoring of other adults. They are also more likely to be embarrassed of their symptoms and go alone into a bathroom or other private space when starting to have a reaction. I totally understand this feeling of mortification. I find it hard too. So technology can help here. Call or message people and let them know how you are and exactly where you are, down to which stall you're in if you're in a public bathroom, so they can check in on you and find you, and in the worst case, call emergency services for you. Moving on to more day-to-day living. If you happen to be allergic to egg, milk, or soy, you may be able to tolerate baked or fermented forms. Back 10 years ago, the info was, nothing is known. Strict avoidance of all forms. The update now is that those with a mild to moderate history are likely to tolerate baked forms. I found that to be true for myself now that my IgE sensitization has disappeared. Tiny amounts can still cause reactions. I suffered quite a few times because I got the notion somewhere that since it's not an IgE allergy, I might tolerate small amounts. You might be lucky and find this is true for you, but be careful until you know. The reaction threshold dose is probably highly individual, and the amount can affect the reaction. One pattern I've noticed is that the smaller the quantity, the more delayed the symptoms. And the reaction may be milder, but still pretty bad. Let me tell you how I found out. The last time I ate actual pieces of shrimp, extreme pain started in half an hour, and the most severe symptoms, like nearly blacking out and vomiting, occurred in about 2 hours. About a teaspoon of fermented shrimp in soup caused similar reactions that were just a tad milder and peaking in about 4 hours. When I had trace amounts of shrimp in broth for dinner, I became increasingly uncomfortable with a sense of extreme bloating, couldn't sleep, and by morning I looked 7 months pregnant. Finally, mid-morning, diarrhea, which only resolved after 10 plus trips to the restroom. But on the bright side, there was no shock or vomiting. FPIES can be affected by cofactors. These are things that can amplify reactions to dangerous degrees. Check out this previous video if you want to learn more about why your reactions might be inconsistent. Personally, I've been affected by exercise, hormonal cycles, and stress, like traveling. When I was constantly consuming my problem foods, these cofactors were the only things I noticed about my patterns, and I had no idea specific foods were the underlying cause. This experience makes me think chronic FPIES may be more common than reported in adults. Many may be undiagnosed or misdiagnosed with things like IBS. Now for the longer-term questions. Will the allergy resolve? Will I ever outgrow it? Even for adults, sometimes yes. Reports range from 17 to 40% who achieved tolerance, and this may take 3 to 7 years. There's some indication that the longer you've had, the less likely you might be to outgrow it, but data is limited. And what about desensitization, something like oral immunotherapy available for IgE allergies? From what we know so far, this is not an option for non-IgE mediated allergies. Avoidance seems to be the answer, giving the body time to forget the trigger. In fact, in a subgroup of people, the side effect of oral immunotherapy is that they develop a mixed non-IgE allergy like eosinophilic esophagitis and other eosinophilic gastrointestinal disorders. Making sure you have optimal vitamin D levels may help reduce your sensitivity. Levels should be checked with a blood test first before starting supplements. Studies show this association is clearer with children and adolescents and less in adults. But if you are deficient, it can't hurt to correct that, even just for your general health. I became aware of this after I noticed my sensitivity to some of my milder allergies reduced soon after I corrected my own vitamin D deficiency. How or when to do a challenge? When might a self-challenge be okay? There's no established standard even in clinic. But if you've had at least 2 years of no reaction, not even accidental exposures, you might start considering this. Sometimes, living life, you do an unintended challenge and find out you're a lot better. When the history is mild to moderate, you can probably cautiously self-test, starting with very small amounts. I'll talk more about this in the future. For severe reactions, and when you also had IgE, find an allergist who can run a challenge in the clinic. Non-IgE mediated allergies have their own version of psychological and social burden, and you're probably dealing with some real grief as well. I plan to make a separate video on this soon, so stay tuned. Feel free to share any of your hard-earned tips or questions that might help others below. And if you've landed here and haven't yet seen my own journey with FPIES, it's right here.